Right. Good morning, everyone. My name is Dr. Choi, as mentioned and several others, and I am, as she mentioned, one of the medical health officers for Vancouver Coastal Health. That means that I'm a public health physician. And I know when most of us think about healthcare, we think about hospitals and clinics and the places that we go when we're sick. But realistically, some people can term this more sick care because actually these kinds of places only determine about 20% of what our health will end up being. 80% is actually determined by the conditions of our everyday life, education, income, and healthy behaviors like the ones we've talked about, physical activity, sleep, as well as healthy eating. Now, I know when we talk about these things, it's very easy to think, oh yeah, I know that physical activity is important. We've been talking about this for ages. But when we look at the statistics, I do wonder if we're really acting as if we know that, and we're building our communities as if we know that. When we look at some of the medical conditions that are plaguing children and youth today, things like mental wellness, we like to think in public health about what I like to call the parable of the bridge. So the parable goes that you imagine that you're at the base of a fast flowing stream. And as you're standing there, you notice there's a kid in the water who's drowning and struggling. So what do? You jump in and you pull them to shore. But then you notice there's another child also in that stream, also struggling. So you jump in again and you pull them to shore too. And then you notice another child. And again, you're pulling these kids to shore, not actually taking the time to realize that upstream of that place where you're standing, there's actually a bridge with a hole in it that's causing the kids to fall in the first place. And so we think about something like mental wellness and the current issues that we're going through with increasing rates of anxiety and depression and eating disorders. And we spend so much time at the base of that stream, pulling kids in with medications and psychiatric care, that we don't look upstream at the things that are causing them to fall in the first place. And the fact is, when we look at the statistics, there are very clear holes in that bridge. It doesn't take a doctor to tell you that if you're not eating right, if you're not sleeping well, if you're not moving your body, you are not going to be mentally well. And when we look at the statistics, it's clear that that's what's happening with our kids. When we look at, what we call the 24-hour movement guidelines and how we're matching up to them, the fact is that we're not doing very well. So the 24-hour movement guidelines, they are age-based and population-based, but when we look at the ones for 5 to 17-year-olds, so school-aged kids, what we see is that school-aged kids should be doing quite a number of things. So the first category is something we call the sweat category. So that's where we look at moderate to vigorous physical exercise. And when we look at this category, kids should be getting at least 60 minutes of moderate to vigorous physical activity per day, and they should be doing muscle and bone strengthening activities 3 days a week. We then have a category called STEM. This is our light physical activity. And we know that kids 5 to 17 should be doing several hours of structured and unstructured physical activity a day. Then we have sleeping. So when we look at kids, and this is again, varies by age, but if we look at kids 5 to 13, they should be getting somewhere between 9 and 11 hours of uninterrupted sleep per night. And kids who are older, 14 to 17, should be getting 8 to 10 hours of interrupted sleep per night. And then finally, we have one that's a little tough for a lot of people, which is sedentary behaviors. So we know that kids 5 to 17 should be on their screens recreationally for no more than 2 hours a day. A difficult bar to meet these days, given how much many of us are on our screens. And they should also be avoiding sitting for long periods. Now, it probably doesn't surprise you that a lot of our kids in Canada are currently not actually meeting these guidelines. So we have a report that comes every year called the Participant Action Report, which is a comprehensive report of how kids in Canada are doing on some of these metrics. It's a report card, and that's the format of it. And if we look at the 2024 data, kids in Canada got a D plus for physical activity. And that is because more than 60% of kids were not actually meeting those physical activity guidelines of 60 plus minutes a day of physical activity. When we look at sedentary behaviors and screen times, it's even worse. More than 7 in 10 kids are actually not meeting those guidelines and are on their screens and having sedentary behaviors that exceed our guidelines. And if we look at all four domains it really gets sobering because actually 95% of kids are not meeting these guidelines. So 95% of our kids we know are suffering some of the ill effects of lack of physical activity. And we know this is having a global impact. So if we look globally, we know that physical inactivity leads to between 3 to 5 million deaths every single year. And in Canada, physical inactivity is one of the leading causes of death. And even aside from mortality, many of us know that physical activity has enormous co-benefits. Many of us know about the cardiometabolic benefits. So, we know that if you're physically active, you have a lower rate of high cholesterol, high blood pressure, diabetes, and heart disease. But, as some folks were saying, one of the things that we're talking more about is the mental health benefits. We know that kids who are physically active have lower rates of anxiety, of depression. We know that they're better with emotional regulation, emotional resilience. They're also better in school. So we know when we incorporate physical activity in the school day, we see higher GPAs, better cognition, better memory. And kids who are physically active also do better socially. We know that this has to do more with belonging, with social capacity and competence. And so, by having kids not actually meeting these guidelines, we are actually missing out enormously, which is why it's so important that just like kids need to learn how to read and write in order to succeed in their future schooling and careers, kids really need physical literacy, the building blocks of physical activity, in order to become healthy and active adults. And so here to talk a little bit more about physical literacy and what it is and why it's important, I will turn it back to Diane Nelson from West Vancouver Schools. Thank you.